This is the rash, the hives.
Rachel Kahn says enduring her post-COVID rash has been harder than dealing with the virus itself.
It was really thick, like a big bump, like a big hive.
Overall, she says recurring rashes that make her face and neck feel hot and itchy have gotten worse since she recovered from a relatively mild case of COVID-19 in January.
My worst symptoms were headaches.
Studies have linked skin conditions like Kahn's to the virus.
It was just burning. I felt like my face had a fever.
Kahn, the owner of a daycare in Toronto, says she is also suffering from sleeping and appetite issues, as well as so-called brain fog, meaning she has moments when she is not mentally sharp.
I'll be doing something, or I'll be talking to someone, and I'm like, what was I saying again?
This is all relatively new, and we are just starting to learn about it.
Niagara Health infectious disease doctor Kareem Ali says studies show between 10 and 70% of COVID-19 patients will suffer from so-called long COVID. He says there is a wide spectrum of symptoms from mild to debilitating, but much about long COVID is unknown, including how exactly to define the illness and its cause.
Is it due to the virus that is living in your body still? Or is it due to your immune system?
That lack of knowledge has been Kahn's experience, who says there is an absence of aftercare for COVID patients. Her doctors have tried several treatments, but none have worked.
She basically said that we haven't seen anything like this. We can't help you. It just shows that there's inflammation in your blood vessels, but we don't know what's causing it.
We don't have a good answer because sometimes there isn't a good treatment.
McMaster infectious disease doctor Martha Fulford says sometimes when the body's immune system is turned on, antibodies can end up attacking the body after destroying the virus.
There's really no good answer on how to turn it off.
She thinks that might be behind Kahn's rash.
That looks like somebody whose immune system's been turned on, who's actually getting one of these weird post-infectious inflammatory things.
Which Dr. Fulford says can often go away with time. But some patients are turning to long COVID clinics, like the one at Toronto Rehab Institute, which is seeing an increase in demand according to Dr. Mark Bailey, who works there.
The more we raise awareness about the ongoing problems, the more we realize there's a lot of people out there who are experiencing symptoms and aren't back to normal.
Dr. Ali says there will be more and more people suffering from long COVID as the number of cases of COVID-19 continue to rise across Canada. There is research being done to better understand it, including in the U.S., where in December, the U.S. Congress announced more than $1 billion in funding for a study in long COVID.